Good morning. We hope that everyone is having an amazing day on purpose so far. Welcome and thanks for joining the PATH Collaborative Planning and Implementation Initiative Best Practice webinar series. Today's session is the Enhanced Care Management and Community Supports Provider Peer Support and Contracting Self-Assessment session. My name is Ita Johnson, and I'm from Public Consulting Group, a co-lead for the CPI initiative. I'm joined by my co-lead, Elise Memo, Rebecca Rose, our program manager, and Emma Trucks, our senior advisor. I'm also joined by our DHCS team, and I'm going to turn it over to Shell Wong to introduce the folks on the call.
Hi, thank you everyone. We're really excited to see all the participants here today looking to learn strategies to support your engagement with CalAIM and the goal of improving the quality of life and health outcomes for our population. So as Ida mentioned, my name is Shell Wong. I am the Project Coordination Section Chief here at DHCS. Joined with me today from DHCS is Michael Weezer, Chief over the Managed Care Program Oversight Branch. And we also have speakers today from Intrepid Ascent, HC2 Strategies, and Health Begins. And with that, I will pass it back over to Ida.
Thanks so much, Shell. Really appreciate that. So, what is PATH, Providing Access and Transformation to Health? Providing Access and Transformation to Health, also known as PATH, is a 5-year, $1.85 billion initiative that's really focused on building up the capacity and infrastructure of those on-the-ground partners, such as the community-based organizations, our hospitals, county agencies, the Medi-Cal tribal and designees of the Indian health programs, and others that are focused on successfully participating in the Medi-Cal delivery system as California widely implements their enhanced care management and community supports and justice-involved services under the CalAIM initiative. It should be noted that PATH is intended to complement and enhance the other CalAIM funding efforts and should not serve as a primary source of funding. PATH funding for all initiatives is time-limited and should not be viewed as a sustainable, ongoing source of funding. Today's agenda, we are going to cover and introduce the webinar series as we've done, and then we're going to focus on California Advancing and Innovative, the Medi-Cal educational events, the provider forums, CalAIM contracting readiness self-assessment, and then we'll have a brief audience Q&A. I'm going to be passing it over to my colleague, Elise Memo.
Thank you, Ita. My name is Elise Memo. I am a Director of Operations at Public Consulting Group, and I serve as a co-lead for the CPI initiative alongside Ita. So we have 4 distinct initiatives that exist within the PATH program that Ita had outlined for us. And today's webinar is hosted by the Collaborative Planning and Implementation Initiative, or affectionately called CPI initiative, which oversees the administration of county and regional collaboratives aimed at promoting readiness for ECM and community supports. Our cited initiative provides capacity building opportunities for the provision of ECM and community supports. Our TA Marketplace, Technical Assistance Marketplace, provides technical assistance to key stakeholders involved in the ECM and community supports readiness and implementation process. And finally, the 4th initiative is our Justice Involved initiative, which provides funding to support planning, infrastructure, and capacity development for implementation of the full suite of statewide CalAIM JI initiatives. Next slide. Just some additional background on the CPI initiative. There is a single PATH-funded CPI collaborative in each county or region. These local collaboratives are working together to identify CalAIM implementation issues and corresponding solutions with key stakeholders in each county or region. Over the last 11 months, our facilitators have conducted stakeholder surveys, information gathering sessions, and participant listening sessions to identify resources and best practices for entities engaged or interested in engaging in ECM and community supports efforts. Next slide. The best practices that we have started to pull out of our CPI initiative are generated from a wealth of diverse knowledge and experience There are over 1,300 individual participants attending CPI convenings across all counties in the state, and there are over 911 unique organizations represented, ranging from direct care providers to MCPs to FQHCs and beyond. Next slide. As you can see on this slide, every county has had numerous organizations involved in the CPI initiative. If your organization hasn't begun to participate, we encourage you to join your peers and help make CalAIM a success for the Medi-Cal population. We're going to drop the link to register into the chat, and I believe we'll be also dropping it a bit later on in the presentation as well. So go ahead and click the link, and you can explore registration options. And I will now pass it back over to Emma Trucks to review the objectives for today's session.
Thanks, Elise. So this is the first best practice webinar in a series of events that will be going on over the next few years. So these events will take place biannually, and these best practice webinars are designed to highlight best practices for implementation of ECM and community supports, to increase providers' successful participation in CalAIM, and to improve collaboration with the entities involved, like MCPs, state and local government agencies, direct provider organizations, and others, to build and deliver quality services for Medi-Cal members. And as Elise showed you on those data slides, these best practices are really being lifted up from a wealth of knowledge and experience all across the state from a large group of participants, which is wonderful. Next slide, please. Specifically today, we hope that by the end of today's event, you'll be better equipped to meaningfully engage in peer-to-peer support, as well as know what to do to conduct an organizational self-assessment to determine your organizational readiness and capacity gaps for CalAIM participation. And Aita mentioned earlier, but we are going to have a Q&A section at the end, and there is a Q&A feature within Zoom. I think someone has already used it, but that's how you can submit your questions. You don't have to wait till the end to submit the questions, so please feel free to use that as you hear the presenters present their different resources and activities. Next slide, please. To get us started, we have two speakers from two different organizations who will be talking about opportunities to engage in peer-to-peer support. First, we have Denise Denoto, a senior consultant of community change from Intrepid Ascent. Intrepid Ascent is a consulting partner focused on helping communities collaborate to deliver equitable, whole person care. Since 2013, Intrepid's expert team have woven together strategic planning, governance, technology, quality improvement, and user experience elements to match the multidimensional opportunities faced by their clients. Denise has over 20 years of experience in healthcare, payer relations, and health IT, and she joined the community change group at Intrepid, where she continues to engage communities in addressing systems-wide change and collaboration between health and social services. Welcome, Denise. We will also be hearing from Dr. Dora Barilla, who is a co-founder and president of HC2 Strategies. HC2 Strategies, a California-based company, facilitates 6 CalAIM Path Collaboratives covering 21 counties. HC2, which stands for Healthy Connected Communities, works with health systems and hospitals, physician groups, communities, and other nonprofit organizations across the country to connect and transform the health and well-being of their communities. They work to integrate the clinical and social aspects of community health to improve equity and reduce health disparities. Dr. Barilla has more than 30 years of healthcare experience implementing innovative models of care to improve the health and well-being of entire communities. Dr. Barilla also served as Assistant Director for the Institute for Health Policy and Leadership at Loma Linda University and currently serves on the boards for the San Antonio Regional Hospital, the Inland Empire Community Foundation, and Medical Teams International. She is the president and founder of Partners for Better Health and the co-chair of stakeholder health. So we're really excited to have both of our speakers with us today, and I'm going to turn it over to Denise to get us started.
Thank you so much, Emma. Everybody can hear me okay?
Mm-hmm.
Wonderful. I want to start by thanking PCG and DHCS for the opportunity to share today. First, acknowledging how amazing it is to see the turnout for the first of these presentation series. A colleague of mine mentioned the other day that it really speaks to the need and highlights the value and importance of the collaborative planning and implementation initiative as a whole. We recognize that CalAIM is an amazingly robust and complex, inspiring program with wildly important goals and transformative impact. That said, we also recognize that there is still work to be done to provide the support needed to succeed, including helping to increase general awareness of what CalAIM is. Next slide, please. And so today I'll talk briefly about CalAIM 101 and CalAIM Academy and how they both distill and synthesize aspects of CalAIM in such a way that provides a level of foundational knowledge to an expanded audience. Why is that important? Next slide, please. It's important because by increasing exposure and that foundational knowledge, we strengthen those links between enhanced care management, community supports providers, and other referring providers in the community. It's a simple truth that while this amazing work is happening in communities across the state, day in and day out, without knowing that these programs exist, we are limiting the impact that they have. The purpose of CalAIM Academy and CalAIM 101 is just that. It's about increasing overall awareness, opportunities, and exposure to CalAIM. It's about establishing that foundational knowledge for enhanced care management and community support services. It's also about accommodating all community stakeholders in path collaborative conversations and translating some of the complexities of CalAIM into understandable and actionable messages. These sessions are designed to highlight this unprecedented moment to transform Medi-Cal, a moment and a movement that other states across the nation are looking to California as a trailblazer. These series and the provider forums, which are really cool, by the way, that HC2 is going to talk to you about shortly, open up opportunities to provide and learn from real-world experiences of other providers. And based on our initial success, we were really looking at ways that we can expand these types of sessions to new topics and in new audience formats. Next slide, please. So how does attending CalAIM 101 and CalAIM Academy help achieve increased utilization in CalAIM services? Simply put, it creates an additional space for provider organizations to learn about CalAIM, dialogue, and understand the potential benefits of engaging in CalAIM ecosystem at the local level. The sessions are structured as sort of that launch point for those that are curious about CalAIM. In fact, we've seen some participants joining CalAIM Academy with limited to no familiarity with CalAIM. More specifically, enhanced care management and community support services. By attending CalAIM Academy and CalAIM 101 sessions, individuals ideally are able to promote the value of CalAIM across their organizations with their clients and community. Learn more about providers in their region and referral sources available. Break down some of the complexity and leave these sessions with a better understanding of the purpose and the structure of these services. It's also designed to help provide that foundational knowledge again on contracting processes, readiness, and what plans are available in a region through a centralized platform. And again, it's really meant to be the starting point for some of those conversations. Next slide, please. As I mentioned before, the overall objective of these sessions is to reduce the barrier to entry to participate in enhanced care management and community supports, and increase the number of organizations contracted to provide these services, increase capacity for enhanced care management, community supports in a local community, and increase the diversity of the organizations serving ECM beneficiaries and those receiving community support services. After attending CalAIM Academy and CalAIM 101, individuals should be able to do these things. Ultimately, it boils down to understanding next steps to move towards readiness, contracting, and if already contracted, increasing referrals. Next slide, please. We've listed here some resources. This presentation is being recorded, and this material will be available after the session. So I'm going to skip ahead to the next slide, and we'll dig a little bit deeper into CalAIM Academy. CalAIM Academy in particular began with 3 types of sessions. They were designed to centralize messaging across six managed care plans in San Diego, thereby attempting to reduce that administrative burden for individual organizations. The first event we call CalAIM Curious was originally designed for non-contracted providers who want to learn more about CalAIM and providers who are interested in contracting with new managed care plans. However, we've seen 2 things. We've seen onboarding of new contracted providers and those participants in the PATH CPI collaborative. We've also seen organizations who are providing enhanced care management community support service offer these sessions to additional staff members within their organization who maybe are less familiar with enhanced care management community support services on a day-to-day basis. The next series is a lunch and learn. Intrepid and the PATH CPI host this session, but each of the managed care plans sign up and show up for the community and present on some of their unique processes associated with population of health eligibility requirements, authorization and referral requirements, processes associated with those, high-level billing information, and access to particular resources. The last of the series right now is office hours, plain and simple. That's what they are. They're an open forum for individuals to ask questions to managed care plans. So each of the managed care plans participates, and it's a way for individuals to engage and interact with managed care plans on a one-on-one basis to go over different operational issues, other types of questions that may be unique to a specific managed care plan. Next slide, please. Another quick point, and not to sort of overstate the obvious, but these sessions are virtual, much like today. And so anything that can be done to really think creatively about the tools that we use to engage audience is key. The more creative, the more interactive, the better. And that way it sort of creates that environment to promote participation and dialogue. In addition to that, and this is pretty standard practice, we also collect feedback at the end of these sessions, and we use that feedback to iterate for future sessions. And then my last slide, please. Thank you so much. I'll sort of close on the impact by the numbers. So the response, I think, to CalAIM Academy has been overwhelmingly positive thus far. Quantitative and qualitative data really indicate that San Diego providers are interested in learning more about CalAIM, and the Academy helps on their journey to do just that. It's an important way to increase awareness, as we've said, and that general outreach, and the outreach and link to the PATH CPI collaborative as well. And that way, that collaborative can pick up after that foundational knowledge and engage in conversations that continue to push forward towards solutions and to testing changes to implementation of these services. The other last thing that I'll say with regard to CalAIM Academy is that it allows for an iteration over time. Topics can be introduced as local and state drivers evolve. And the success that we've had thus far is encouraging us to have some conversations at the local level about ways in which CalAIM Academy can sustain through the county long term. So I'll thank you so much for your time, and I'll hand things over now to Dora.
Thank you so much, Denise, and good morning, everyone. My name's Dora, as Emma had introduced, and I'm with HC2 Strategies. And I really want to echo what Denise has said in terms of the gratitude for PCG and DHCS for creating these forums that we can all learn together. And we really want to share kind of the purpose of the CalAIM 101 is that as we move forward and have conversations in our collaborative planning and implementation forums each month, you know, we really found that there were people on all different levels of readiness, and to really iterate and find how can we ensure that everyone has the education and the information that they need. And hence, you know, you'll see CalAIM Academy and CalAIM 101. And so if we'll go to the next slide, I'll go briefly into our CalAIM 101 and then share a little bit more about our provider forum. So CalAIM 101, it really is the target audience is just that anyone that's perhaps new to an organization that is already contracted in with CalAIM, or new organizations that are interested in CalAIM and really haven't heard much about it and don't, you know, we're entering into the collaboratives and really needed a little bit more information so that they could engage with the conversations in terms of where we were in the collaborative monthly meetings. In addition, we had community organizations that really wanted to learn more about how to make referrals into ECM and community support services and just wanted to learn more about the whole ecosystem. In addition, you have lots of staff from county agencies, and we're really excited that the managed care plan representatives really were a part of the conversation, who had detailed information and knowledge around contracting. So they were available. And we could, as Denise said, you know, when you had multiple managed care plans, an opportunity to really help align what are some of the shared practices for referrals and authorizations, and how can we simplify some of the information for those that are interested and really new to CalAIM. So next slide. So how does it work? Just share a little bit about our agenda and how we really constructed the CalAIM 101s was really based on feedback. We're constantly listening to providers and really trying to kind of just-in-time information so people don't get lost or get confused or get frustrated in the process, but really assessing where are participants along the journey. And in a moment, we'll take a poll. And in the beginning of our CalAIM sessions, we would really poll who's there. And we'll talk a little bit more about that. And then really an overview of Medi-Cal and CalAIM. We found that don't make assumptions on what people know and where their information levels are, that people really want information. We try not to go into the weeds. We offer additional resources and information if people need more information, but really try and stay high level and give that overview. And then we really share what's the value of an organization. Many people were on the fence, like, do I want to engage? Does this make sense? Why would I want to be involved? And really looking at the value and, again, just the historic opportunities in transforming our community health systems. And also, what's the structure? How does this all work? Who are the players? There's a lot of acronyms and a lot of different components. So really trying to explain who all the players were and how the structures work. Again, don't make assumptions. We would always define what is ECM and Community Supports. Continuously, we try not to use acronyms. We have, just try to stay on guard with that, but just make sure that people really understand what it is, the different services, and then the populations of focus for the ECM. Share with them what are the funding streams and opportunity in CalAIM, so people can start thinking about not only contracting, but how do you blend and braid some of the other funding opportunities. We go into just an overview of how to contract and provide resources and some basic information, and share how to connect with their managed care plans. And then if needed, we do breakout sessions and really just get people in sessions so that they can ask questions. We'll often break them up into, groups based on what their needs are, so that even in a larger group that they can feel safe to ask questions. And it's really a level playing field. And then always offering additional links and resources to support CalAIM engagement and information. So kind of what is some of the basic information, and then building upon that. So next slide. So that was really our agenda, but we're going to open up a poll here right now, and we encourage you to take it. This is a sample of what the poll that we share in our CalAIM 101. And again, this is so we know who's in the room, so we can really cater our message and our, whatever we're talking about, or our breakout sessions based on who is in the room. So this is, where are you in your CalAIM journey? Are you just, as our colleague Alexis from Help Begin said, are you CalAIM curious? You're new to your organization. You want to explore contracting and become a CalAIM, either an ECM or community support provider. You're contracted and maybe you're new to this work and want to learn more. Or maybe just your organization wants to learn more about how to refer for CalAIM services. So perhaps you're not a contracted provider, but want to engage. So I encourage you all to take the poll, just so you can see if any of you are in the room. And then there's others. So if you're attending the webinar and you don't fit into any of those categories, but again, we just hold this poll open and then share the results, so we know how to cater our information. So I think, are we about 20 seconds in? Are we ready to show the results?
Yes, let's display the results.
Perfect. So you can see very quickly that 35% of you are contracted for CalAIM, and you're here and you're new to this work and you want to learn more. And then 24% are other. So we would dig into that a little bit more in our CalAIM 101 to really see who's in the room. And then we can actually do breakout sessions based on who's actually there that specific day. So it's a great way to engage and get people the information that they need without repeating or just giving them information that really isn't valuable to them at that moment. We call it just-in-time information because we know there's a lot of information out there. The next slide, please. And again, just ways to engage in CalAIM. We provide a lot of links in terms of our number one thing is connecting them with their managed care organizations in their county to make sure that's step one. And then get them engaged in the collaborative planning and make sure that they're registered, so that we have a lot of people that are statewide providers, and ensuring that they're all registered, and we would provide those links. We'll talk about a provider forum that we have on a regular basis. As Denise mentioned, we also have office hours with just kind of an open time for people to come and ask questions if they ever need to. And then, as we mentioned earlier, the links from DHCS, so that they have the information that they need. So there's lots of different information based on, again, what their needs were, who they were coming in, and then sharing funding opportunities, and then emails for individuals so that they can contact and they have the information that they need. Often we find people have a hard time kind of digesting a lot of the information, but we can help distill that and give them that just-in-time education and information. Next slide, please. And again, just some best practices. We offer this quarterly. We do ask them to register so we know who's attending, and if we need additional support in terms of facilitation. And then we always want to make sure that we're engaging, and so doing the polling, having breakout sessions, and then we're consistently getting feedback from participants in terms of surveying them to help us really guide the content and information. Next slide, please. And so again, the benefits, as in terms of the outcomes, we've doubled our attendance from the first and second events. 50 to 60% of those that are registered are actually attending the event. And then it's really increased our participation in the monthly PATH collaboratives as well. And people feel like they have the resources that they need to fully engage in the conversation. So next slide. And again, here's just some a slide deck of what we're presenting, so you guys have access to the information. And then we also share our our email if anybody has any additional questions, and we can cross-refer. Next slide, please. In addition to Intrepid Ascent and HC2, many of the other facilitators around the state are also providing additional forums for education, recognizing the same needs. So you'll have this information in the deck from the Health Improvement Partners of Santa Cruz, Institute for Healthcare Improvement, and Transform Health. So this information will be available to you as well. Next slide. So let's talk a little bit about the provider forums. And this is, I have to say, CalAIM is a best practice, but the provider forums are a really best practice, that we have found that peers want to learn from peers. And if you'll go to the next slide, this has really been probably more successful than we originally anticipated, and are looking to grow and evolve that. But this is exactly what it talks about. It's provider forums, and the origins of it was that the providers wanted to learn from other providers. And we'll really have to give credit to one of our providers in Colusa County, Jason McMullen, said, why don't we have a provider and just start learning from each other? Because they were finding that was the best way for them to learn, was from each other. So what HC do is, it really just sets up we set up the Zoom, we provide support and, everything that they need, but it's really led by providers. And it's that regional discussion that we were having in Colusa County, and then it really grew statewide, because it was the learning was just so, the appetite, and people were learning so much in these 1-hour sessions. All the topics are from the providers, so it's from our collaboratives, the feedback from the collaboratives, and the surveys that we hand out each month, so that it's really just in time education. And we continue to iterate. We don't have slides, we don't do presentations. It's really a forum for asking questions and really engaging providers to providers. Next slide, please. The logistics, it's the third Wednesday of every month. We promote these in our collaboratives. So again, Jason McMullen facilitates it. It's hosted by one of our from HC2 Strategies. The team meets monthly to plan the forums. They're promoted ongoing. All the MCPs are engaged as participants. So they're there in case they're not leading it, but they're there if there's any questions. And I really just want to reiterate, this is run by the providers for the providers, with us just setting up some context and some support. Jason often refers to this as the monthly collaboratives are the class, and this is the study group, so that all of the providers can learn from each other. And there's breakout sessions if we need them, and then again, we're always sending out surveys. What can we do better? What do you need to know? Next slide, please. And so in terms of how does attending the CalAIM Provider Forum really help in terms of increasing utilization in CalAIM services? We have just seen an enormous uptake in providers learning from each other. They want to know, hey, what's the real deal? I read the links, but what's the real deal? How can we overcome some of the challenges that we're having? It really creates this network of learning amongst providers. When they're on the call, hey, here's my email. Can I call you afterwards? Can I connect? What did you do with the technology? How did you deal with this situation? And so then it creates this communities within communities of practice for all levels of readiness, whether you're just starting and you want to talk to someone who's been in it for a year, or if you just want to be with a group that's just that are newcomers to CalAIM. And it provides that space for us also to explore resources. Providers will share resources and materials, and it is a rapid fire exchange of information. Next slide, please. So we are really excited as we're moving forward, really in terms of identifying what providers should do when they leave, after they leave. Really, it gains confidence because they're hearing from other providers, really helping them make some of the barriers that they were that were implicit, explicit. Those connections amongst all the providers is absolutely invaluable. You see a network of people just learning from each other and sharing those best practices. And it also helps build those relationships because it's a level set. So the MCPs come in and chime in as resources. They're not leading the conversation, but really leading. In terms of looking at it becoming a contracted provider, increasing their capacity, and then really experience this rapid cycle learning from each other. Next slide, please. The audience, we have them from all over, from case managers to, new to CalAIM, exploring contracting status that are just contracted or experienced. Next slide, please. So who's attending? This is, I think, the big news of the day. You'll see in our word cloud some of the counties that are attending. The bigger the word, the more from that county. But you'll notice that when you register for this series. But yes, those numbers are real, that we are actually now at 700 in terms of providers that are registered, and our attendance is continuously increasing. This month we had over 150 in attendance, so you can see the need there. Next slide, please. Here are some resources.
Yes.
Are you ready, Emma? Okay. Here's the resources, and then just what's next. I'll finish up here. Go to the next slide. Here's some resources for the CalAIM provider. Next slide. Others that are doing things, and then next slide is really what's next. So continuing to iterate on what we're building on. So I will turn it over to Emma. Sorry, we got excited there about what was happening with the provider, but it's all yours, Emma.
Thank you, Dora. And I just want to note there's been a lot of questions in the Q&A about links to all these resources. We're going to drop those into the chat again for you right now, so you can access those. So if we go to the next slide, we're going to transition now to focusing on contracting readiness self-assessments. And we have Health Begins, 2 representatives from Health Begins to walk us through that. So we go to the next slide. Health Begins is a design and implementation partner that helps Medicaid-serving clients move upstream and advance health equity for people and communities harmed by societal practices. Our first speaker will be Alexis Taylor, the Senior Program Manager at Health Begins. Alexis is a third-generation advocate of structural equity with an 8-year track record of providing strategic oversight and consultancy to equity-driven programs and initiatives. Upon receiving an aggressive breast cancer diagnosis while pregnant, Alexis faced discriminate obstacles to obtaining equitable health care. After completing her treatment, she advanced the actionable pursuit of race and gender justice via the development of electorate expansion strategies for a current United States Senator. Alexis is deeply committed to her family, and she's passionate about writing, storytelling, and teaching. We also are joined by Eva Bataya-Mann, who is also a program manager at Health Begins. Eva has dual master's degrees in public health and social welfare from UCLA. She has experience working in various areas, including arts programming for incarcerated populations, weight stigma in clinical settings, community food justice movements, and support for unhoused communities. Before Joining Health Begins, Eva created and managed programs to support community clinic staff in LA County to successfully navigate challenges to the COVID-19 pandemic. I'm going to turn it over to Alexa to get us started. Thank you.
Thank you so much, Emma. And can everyone hear me clearly?
Yes.
Wonderful. I definitely want to just echo the sentiments of our colleagues on the call today, especially Dora, and just expressing the excitement about being able to have this shared space to share just important information, right? And so I'm really excited to join Eva in discussing how organizations can self-assess their readiness to become a contracted provider. And so to provide some context, at the onset of CalAIM, a lot of organizations expressed a really strong interest in wanting to join this thing called CalAIM, but they didn't know how. They saw all of the value, but they just didn't know how to join this landscape. And so resultantly, in 2021, Health Begins was funded by the California Healthcare Foundation to really design an intervention to increase contracting readiness. And we partnered with Aurora Health Group and Transform Health. And as a result of that funding opportunity, we hosted 26 contracting technical assistance sessions across 15 months. And we partnered with 4 managed care plans and delivered TA to more than 1,200 participants. So there were a lot of learnings that came out of that really grand experience. And so what we learned from those providers that really want to participate in CalAIM was fourfold. Relationships are key. Once again, reflecting on what Dora stated, we cannot drive home the importance of relationships enough. Next, we understood that providers also needed a lot of support understanding the cost of becoming a provider. Like, we have operated in this approach for so many years. Now we're transitioning to Medicaid. What does that mean, and what are the costs associated with it? There was also a lot of difficulty transitioning to Medicaid billing. And so that was another lesson. And then lastly, we realized that these providers also needed support with seed money or upfront funding in order to launch their programs. And so essentially, based upon all of those learnings, we took that information and put it into a very easy to understand contracting best practices guide. And the ultimate goals that we had of designing this guide was to, number one, support those organizations' ability to contract, to be a part of this CalAIM landscape. Next, of course, a foremost goal is to expand the provider network, and that leads to driving utilization. And if we go to the next slide, I'd also like to discuss who this guide was created for. While there are many provider types that would definitely benefit from the guide, we understand that smaller community-based organizations, they are lesser capacity, and that makes navigating the contracting process a lot more burdensome for them. When you only have, 10 staff, 12 staff, that's challenging. And so when we refer to CBOs as a part of who needs this guide, we're really talking about those small local organizations that employ a community workforce. And so therefore, self-assessing is really going to be beneficial to those types of organizations. But that self-assessing step, it had been missing from the conversations. It was, okay, here's this thing called CalAIM. We want to participate. Wow, contracting is hard. How do we get ready for this? So now we want to actually walk through how they'll be able to self-assess. And so there's going to be a link in the chat if it's not already there that has gives you access to the guide. And so you'll see that the guide is developed really using this very simple ready, set, go model. And the first set of the model under the get ready is to self-assess your organization's readiness by understanding the people, processes, and systems that you're going to need to become a provider. So people, processes, and systems, that is what you're assessing as it pertains to wanting to become a contracted provider. And if we go to the next slide, we'd love to do just a quick poll, to understand once again who's in the room right now and where you guys are navigating the contracting process. So let us know, are you self-assessing? Have you heard of self-assessing? Are you expressing interest to an MCP, meaning that those conversations have already started? Are you in the credentialing process? Are you already filling gaps as a result of credentialing? Are you not sure? That's totally fine if you're not sure. Going back to what Dora stated, there's a lot, right, within this CalAIM landscape, and there's no expectation that those providers that want to join this network will know all of the jargon yet. So if you don't know, please feel more than free to say you're not sure. And then also we have this entire group of those organizations that have already navigated this process, whom we've garnered these learnings from. And so you might already be contracted. So feel more than free to go ahead and participate in this poll to let us know where you all are. All right, so we have a nice amount of providers or potential stakeholders that are not sure. And we also have a nice chunk that are already navigating the process from self-contracting onto credentialing and gap filling. This is really great information. And so because we know that in order to drive the utilization of services, welcoming more providers is key. So we're really hoping that being able to self-assess is what's going to expand the network. And if we go to the next slide, I'd like to talk about, for those organizations that are navigating the contracting process, how you're going to benefit from this. So I'll run through this slide quickly before I pass it over to Eva. And so this contracting best practices guide, the self-assessing component under Get Ready is going to walk you through, number one, the requirements of becoming a provider. This includes understanding the service definitions, the standard terms and conditions, and the models of care. What is all of this? It'll make sure to walk you through that. It'll support you in examining your own policies against those requirements. So you can see, like, where are there gaps? This is a requirement. I don't yet have a process for that. Oh, okay, I see this is a gap that I need to fill. You'll also be able to understand reporting. This includes the data elements that you'll need to incorporate into your report so that way you can make sure that your processes already proactively incorporate those elements. Importantly, going back to what I was saying earlier, you'll be able to assess the shift from Medi-Cal to Medi-Cal billing. Organizations that are new to Medi-Cal billing, there's a learning curve, and that's okay. So we've aggregated some of those resources to support you in navigating that shift. And then lastly, and importantly, you'll also be able to assess some of those workforce gaps, meaning that you'll be able to understand what people you will need to successfully render these programs. And so after achieving those specific learning outcomes, we wanted to include some key questions that you can ask your organization so that way you can take next steps. We don't want to just talk in theory. We really want to shift from theory to practice. And so some of those next steps, those key questions that we've included are, after you've self-assessed, how much is it actually going to cost to run your program, accounting for all of those requirements? You'll be able to do that after reviewing the contracting guide. What is the pathway that your organization needs to take in order to participate in CalAIM? Do you contract directly with a managed care plan, or based upon the outcomes of self-assessing, should you assess becoming a subcontractor, if your managed care plan allots for that? What resources have you already examined and tapped into? Have you considered the TA marketplace for receiving support? Do you even know what that is? Have you tapped into Cited? Have you tapped into IPP? It'll once again walk you through those resources. And most importantly, as mentioned by both of our prior colleagues, building relationships is going to be critical. So we really want to know, have you joined a CPI collaborative? Has that taken place? And so with all of that being said, I'll pass it over to Eva to discuss why expanding the provider network is so important to driving utilization.
Thanks,
And
Alexa.
Eva, I'll just note there's about 3 minutes left before we want to move to Q&A.
Okay.
3 or 4 minutes.
I'll make it quick. So we really want to ground ourselves in what this means for utilization, and in turn, what is the actual impact this is going to have on communities. This is obviously important, as the crux of this initiative is to really improve access and those health outcomes as a result. So increasing readiness means an increase in contracted providers and an overall expansion of that provider network. So stakeholders have found that expanding the provider network, especially for rural and under-resourced communities, is essential to increasing utilization. So by broadening service availability, both geographic and availability of service type, there's a greater awareness that these services exist, and there are also fewer barriers to accessing them. This means increased visibility so that community members who maybe were otherwise unaware of services or had experienced prior barriers may now feel like they're able to pursue services, or maybe are even made aware of services they didn't know existed. So really grounding ourselves in the impacts of increasing readiness. Next slide, please. So 95% of participants who participated in the TA sessions said that these sessions improved their understanding of what it takes to navigate the contracting process, and the specifics of what they shared were used to inform this guide. Next slide, please. So what are the next steps? Alexis mentioned the importance of relationships. It is essential that in this stage, potential providers are engaging partners. building relationships with peer organizations, county agencies, and MCPs is essential to bolstering the journey of becoming a CS provider. And joining a CalAIM collaborative is an excellent way to connect with other stakeholders, spend time identifying challenges, and thought partnering on solutions. It's also just a really impactful way to get support and feel like you're part of sort of the larger community. It's also in this collaborative setting that you can gain insight and kind of look into each of these steps, like estimating costs, determining your pathway, and identifying resources as well. And you can click here to identify a collaborative in your area that you can join. Next slide, please. So here are some other important resources that you can reference sort of at your leisure for self-assessing, estimating costs, and identifying resources. Next slide, please. And here you can click the guide to access it and kind of walk through the specifics of what we've identified previously. Next slide, please. This is our CPI project team at Health Begins, just to give you a sense of everyone who's been working on this initiative within Health Begins. Next slide, please. And there are some other facilitators in the CPI space that are offering similar self-assessment resources that you can engage with, and you can see those presented here. Thank you.
Thank you so much for that, Eva. We appreciate you being here. And now we are going to jump into a few questions. So our first question we have is for Denise and Dora. Are these 3 different education options happening at the local/county CPI levels, or are they happening at the state level?
Thank you, Ida. So the HC2 Strategies has 6 different collaboratives, and so we do them across our 6 collaboratives, and we welcome anybody to attend. So for the CalAIM 101, you know, we really open it up for anybody who wants. It's very generic information, and then we try and refer off and ensure they're attending their local collaboratives.
Ours are open to the public as well. It's not a closed session, but they do include information at the local level. In particular, it started with San Diego's collaborative. So it includes information from the 6 managed care plans in the region presently and some processes that are specific to them. But it is a service that we're offering in our other collaborative with the same sort of methodology to include the local managed care plans and representation there to address any questions or unique contracting requirements.
Thanks so much. We have another question for Denise and Dora. Can CBOs obtain the Cal 101/CalAIM Academy materials to host their own sessions for provider collaboration?
They're welcome to. Actually, we put the link in the chat, so we're happy to share the information. A lot of it comes from DHCS, so we're happy to share those links and any of the information, you know, if needed.
Same here. I don't think that they're currently published right now. We usually hold them as live webinars. But we can send them over after today's session. They can go out with any of the additional reference materials.
Thanks, Denise. We also had a question. Is there a forum or resource to review best practices in summary that's come out of these collaboratives for new providers just now entering the field? So thank you so much for this question. We are actually building up our best practice resource guide that will be found on the CPI website. So please check back for updates. That's something that's going to be updated regularly. The link to that has been posted already in the chat and Q&A. With that, we know we have a variety of different questions that came through. Thank you. In terms of time, we're going to go on ahead and take those questions back, field them, and we'll be sharing the slides, the resources, and also the links to this recording on the website. So please check there for follow-up details. With that, I'm going to turn things over to Rebecca.
Thank you, Aita. And as we near the conclusion of today's webinar, we do want to remind everyone that registration remains open to join and participate within the collaboratives happening across the state. There are currently 25 collaboratives with 10 facilitating organizations representing all counties across the state of California. So we do encourage all of you, if you haven't done so yet, to please access the link at the top, capath.com/collaborative, to register for a collaborative, again, if you haven't done so yet. Next slide, please. And we'd like to thank you all for participating in this first best practices webinar. We are organizing our next webinar to occur in December 7th. And the title and preliminary best practices that we will highlight during the second webinar in our series is relationship building with other organizations in the CalAIM environment. So we do hope that you do join for our December 7th webinar as well. Next slide. And as we conclude this webinar, we'd like to thank all of you for coming and participating today, especially all of our facilitators who reported out the best practices that they are currently implementing within their collaboratives and across the state. We would like you all participants to take a moment before you exit our webinar today to answer this poll for us, an evaluation poll, a quick 5-question evaluation poll that we are asking again for you to answer before you exit our webinar today. We do appreciate your time and your feedback, and we wish you all a very good day.